Well, hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center here in Rocky Mount, and I'm so excited to have this fella as a guest. He's a pharmacist. He's the fourth generation in his family to be a pharmacist, and he's just purchased the MedPark Pharmacy about 2 years ago, maybe year and a half
getting
ago.
Close to 2 years now.
Randy Crawford had it for years and years, and he retired, and Thomas went ahead and bought that business. So he's got one pharmacy in Scotland Neck, and he's got one here in Rocky Mount. So this is Thomas McDowell, pharmacist extraordinaire. So welcome.
Thank
Good
you,
to
Linda.
have you with us.
Appreciate you having me on here. And,
So I want to hear
here.
all about the 4 generations. I saw a picture of your great granddaddy because I was looking you up today.
Yeah. So it's in my blood, and so fourth generation. My great grandfather purchased McDowell's Pharmacy. At the time, it was E.T. Whitehead Drug Company in Scotland Neck in 1922.
Wow.
So it's been
That's
about
100 years.
Been about 100 years in our family, and it was already an existing drugstore since 1901. And over in Scotland Neck, we're actually still in the same building.
Really?
Original tile floors, original mahogany cabinets.
I've got to come over and visit.
Yeah,
I want to check it out.
It's trying to retain that old charm, and I think people really enjoy coming in there and reminiscing on some of the old days. We used to have a soda fountain. My grandfather took that out in the 80s. I have thought about bringing it back, but orangeades, lemonades, Coke floats, so a lot of nostalgia there. But one thing has remained the same, and that's taking care of generation after generation.
Right.
So my grandfather took over in the early 1940s out of pharmacy school, and we're all UNC Chapel Hill
Woohoo,
grads.
Go Heels.
Go Heels.
I'm a heel. Tar Heel.
And so it was no other place that I wanted to go, and so grandfather took it over, and then my father graduated in '81, and I graduated from pharmacy school at Carolina in 2016. Came back, started working, graduated on Saturday, started working on Monday at the family pharmacy, and no break.
Right?
And
Jeez.
so started trying to bring innovative services to the community, and while still providing that great patient care. And so I also have a son, 15-month-old son, Press. No pressure. Could be fifth generation, but as long as he's happy.
That's right. That's the main thing.
And my wife, Blaine, who's my business partner here, we purchased Medical Park Pharmacy last year together, and really excited to be a part of the Rocky Mount community. Being from Scotland Neck, this was where we went to do anything.
Sure, of
and
course.
so really
Big
happy
city.
to be here.
Yeah. Is your wife from around here?
She's from the Williamson, Washington area.
Oh, okay, not
so
too far.
not far, and she has her MBA, so she's helps on a lot of the business aspects
That's great.
and the marketing, social
Yeah.
media, HR, and so really fortunate to have her on our team, and so we've just been welcomed by everyone here in Rocky Mount.
Yeah, because you go to pharmacy school, you learn about drugs and learn how to count pills, and I don't know what all y'all do. Do you do any compounding at your pharmacy?
Little bit. We send most of the more complex stuff out to wards, and so we're full service retail pharmacy though. So a lot of the traditional dispensing, along with some medical equipment and some high quality supplements, and we also do a lot of other services such as adherence packaging, multi-dose, sorted by date and
Yeah, we're going
time.
to talk about that. I have a list of all of the things.
So a
you
lot
all
of different
do.
services, but just a little bit of the compounding aspect.
Okay,
So,
yeah.
But used to,
Yeah.
back in the day when my great-grandfather,
Right.
they compounded every single prescription,
Absolutely.
made it by hand,
Absolutely.
everything that they did.
Yeah.
Come a
and
long way.
Yeah. Sometimes I think we need to go back.
There are some, when you see recalls and
Yes,
shortages,
yes,
it does make you
right.
think it'd be nice to just
That's
roll your
right.
sleeves up and do it yourself.
That's right. That's exactly right. But we got to keep on
Gotta keep
progressing
advancing.
on. So it's really a blessing that you've got an MBA because you go to school to learn to be a pharmacist. You don't learn how to be a business person.
Not a lot of classes
No.
towards business. I think we had one where we did a business plan, but I really dove into that, tried to figure it out because to help patients, you've got to keep your doors open. If we're not thriving as a business, the community and the patients suffer.
That's
so
right.
we've got to make sure our business is successful and
Sure.
that we can continue to
Yeah.
care for patients. So it's great to have somebody with that
Yeah,
business
that's
background with
right.
my wife. And
Very helpful.
definitely been
Now,
a
is
blessing.
there any other pharmacies in Scotland Neck?
Just us.
Just you?
Yeah, so
I didn't know
us.
if there was any big CVS's or
No,
Walmarts or
was a-
Walgreens or.
Was a chain that closed up, and
Mm-hmm.
so it was just the town's small. I'm working hard to try to help revitalize it along with a lot of other motivated folks in town,
Yeah,
but it's challenging in those small
Yeah,
towns.
But there's so much history there and so much vibrancy just in the pride of living in that town.
Yeah,
And you got that crazy parking.
middle of the street, maybe one of two places in the state where you can do that.
Yeah,
So
yeah.
no stoplights.
Oh,
So
really?
no stoplights, and we have medians at every intersection in the middle of the road. So you have to stop, look for oncoming traffic, pull up to the middle, and then turn the other way. So if you're out of town, it can be a little bit confusing.
Yeah,
So
if you're not quite used to doing all that.
it sets
But
us apart.
How
but-
many people are in Scotland Neck now? Do you know what the census
maybe
is?
1,500, something like
Oh,
that.
I didn't realize it was that
15,
small.
1,700,
Yeah.
yeah. So we do have Sylvan Heights Bird
Oh,
Park.
yes, it's an awesome place.
That's our
That's-
gym, and so tons of visitors coming
Right.
through to that wonderful waterfowl park, and so
Yes.
would welcome anybody
Yes.
visiting Scotland.
If you
Neck.
haven't ever been there, you need to go. It's great. And there's two things I learned from that place. Well, a lot. But number one, the reason flamingos are pink is because they eat coral.
That's right.
And Sylvan Heights raises all the flamingos for the parks in Florida. Disney and, well, I don't know, do they still have, one of them, SeaWorld, is that still there?
I don't know if that's still around,
But
but-
anyway, I thought that was pretty cool that they raised them here and sent them right on down there.
World-renowned
Yes,
breeder.
yes.
He's Mike Lubbock and Brent and Allie, great team, and they are from. Mike and Allie are from England originally.
Oh,
and-
are they? Okay.
And moved to North Carolina, and they were looking for a farming community because they considered themselves somewhat farmers of birds because they were mostly breeding at that time, and they've brought back birds from the verge of extinction, and so
Yeah.
a big asset to our community.
It's really a fantastic place, and it's not expensive. You can bring your lunch, and they got picnic tables and places to sit all around. And I brought my grandkids several times.
Oh, it's great for kids. So come see that, and then stop in, see a historic drugstore
That's
while
right.
you're
That's
there,
right.
and step across the street to the hardware store and get some ice cream. And
Okay.
it's a good day trip.
Do we have a restaurant where I can have lunch?
Yes, absolutely. We've got several. Sit down wise, La Casetta is great Italian food.
I've heard that it's good Italian food.
And homemade cakes that are amazing.
Uh-huh.
I had a Tar Heel bus tour at Chapel Hill that they do every year of a lot of leaders in academia. They came to our pharmacy
Oh, really?
on their tour just the other day, and I got a homemade cake from La Casetta, and they were raving about it.
Oh, good.
And so that was a really
Well,
neat
that was
experience.
fun.
Yes.
Yeah.
They saw what we were doing in the community, and great experience.
Yeah. So, what precepted you to buy this other pharmacy? It just kind of fell in your lap? That's what happens a lot of times. There's an opportunity and you just take it?
Well,
Or had you been thinking about it, kind of planning that way? Or?
I had always dreamed of branching out and taking on a new challenge. And so Randy Crawford, who previously owned Medical Park Pharmacy with his wife Mary Ann, great folks. They had owned the store for about 30 years, since '91, since that building opened. And he was a longtime friend of my father.
Oh, okay.
Joe McDowell. And so they went way back, and we would see Randy at trade shows.
Sure,
and I told him, hey, if you're ever interested in selling, let me know. And he was ready to retire, and so he came to me, and we worked it out, and just really a blessing that I was able to take over a great store with great patient care already built in.
Right. And it's it's so convenient for so many people because it's right there in the Boyce Willis Clinic. So you leave your doctor from the 4th floor, carry your prescription, and give it right to Thomas or Brandon, and they'll take care of you. So it really is. It was a great place to put a pharmacy. Randy was a smart guy to do that.
Yep, it was a great opportunity at that time, and the location's great. We're right next to Family Medical as well, and right through the parking lot, and so next to a lot of doctors. So really convenient. We're kind of a hidden gem because there's not a ton of signage, but we're full service pharmacy for the whole community. We have a lot of services that we'll get into.
I tend to send my folks. They'll complain about a specific chain. I'll say, you ought to try Next Door, or try Almonds, or try Drugco, because they're small and they take care of you.
Yeah, there's definitely a difference there.
Yes.
When you go to an independent pharmacy, you're not just a number.
That's right.
They're not churning you in and out. You're a person. It's a relationship.
That's right.
And we come out and talk to you. We get to know you, and you need that for your health. Your health depends on it.
Yes.
People
will call and say, can I take this medicine with this medicine? Call your pharmacist. That's, I've got my expertise, and drug interaction is not it.
Well, and we pride ourselves on being, some of the most accessible providers in the area, because you can easily get us. Y'all are busy and, seeing patients all throughout the day. We can, bridge that gap of patients needing something quickly or having that drug question. And so we're here to help, and we want patients to know that they can call us, they can come in, they can talk to us. And you're not always going to get that at some of the big box stores, unfortunately.
No, they're just too busy. They got too much, and then they've got a CEO somewhere that's saying, do this, sell. I guess. I don't know what they do. But
understaffed. I feel for them. But we try to differentiate ourselves from that, and we want it to be a great experience when you come to our pharmacy.
Right. So you said that you have high quality supplements. I'm real big on supplements. I'm a big supplement person, and I'm also very big on high quality supplements, pharmaceutical grade supplements. I tell everybody I'm very biased. I'm very prejudiced when it comes to supplements, and I'll tell them, don't go to a big box, don't go to the Dollar General.
Yep.
And I didn't realize that you had them there, so I can send my folks there too.
Absolutely. We've been building that up since we bought it. So we've got we're a small store, but we've got a really nice selection of items, and some gift items, some local items, and some supplements. And I really try to focus on, like you said, the pharmaceutical grade, higher quality, pure supplements, because there's on the over-the-counter side, there's not quite as much regulation as there are for prescription drugs, and so you really need to do your research on what you're putting in your body, and there are big differences in quality from from the dollar store versus something that's been carefully developed.
Yes. So I believe in supplements, and there's very few people I send anywhere, but I'll put you on my list.
Please do. We've got a good selection. Come check it out.
I will. So you are we'll talk about Scotland next. So what are your hours there? Are you there?
Yeah, so we're 9 to 5:30 Monday through Friday over at Scotland Neck at McDowell's Pharmacy, and over here at Medical Park Pharmacy we are 8:30 to 6 Monday through Friday.
Oh, wow.
And also we're open 8:30 to 1 on Saturday.
Oh, wow. So you're really available.
So we've got great
That's
hours.
awesome. That's
So
awesome.
Catching folks that are working or can't get there during the week. And we've got a lot of other ways that we can help make a patient's journey easier so that they don't have to spend a bunch of trips and time that we can.
Well, and I
talk
know
about.
another thing that I've had other pharmacists in town, smaller pharmacists, when there's a particular drug they need, and it might be a combination of two drugs that are maybe generic, but when you put it together,
Yeah.
then it's an expensive
Yep.
drug. So I've had pharmacists, kind of put that together for me and figure out what the dosage of each one of those two or three generics would be, so that they could get it because they can't afford
Yeah.
the big generic. I mean,
Yeah.
drugs are expensive.
Yeah.
I don't have to tell you that.
Yeah, they seem to be going up, and it's one of those things that's I wish I had more control over, but there's a lot of things that we can do, especially in a local independent pharmacy, to work with our patients.
Right.
Just like you said, alternatives, therapeutic alternatives that are equivalent. We're going to take that extra time to say, hey, what if we
Right.
split these two up?
Right.
They're both generic if you split them up, and then you're going to save a couple $100 versus that combo might be slightly more convenient, but is it worth $200-300 copay?
No.
Probably not.
Probably not.
It's not if it's going to be equally effective
Right. That's
separate.
right. That's
So
right.
that's a great
Yeah.
example
Yeah.
of trying
That's
to work
just-
around
right,
the barriers.
Right. That's just one of the reasons why, smaller pharmacies are so great. Their hours might not be as convenient as some. They're not going to have a 24-hour drive-through, that's for sure. Although they don't even have that going all the time anymore because of staffing issues.
They've been closing randomly because of staffing throughout. Sometimes middle of the day, I've heard.
Yes.
And I
Yes.
hate that for the patients.
I know.
They're the ones who suffer.
Yes, I had a patient tell me, I called to get my medicine and it was going to be 17 hours because they didn't have staff. And you can't blame the pharmacy. I mean, nobody's got staff. People, I don't know where they are, what
That's
they're
a common
doing.
theme.
Yeah, right. So you can't really blame them for that, but it's tough when you've got, you're promoting a certain thing and you can't fulfill it because of other people.
Yeah.
So-
So I'll jump in and help and cover whenever we're,
I know you
so
would.
that's
I
the
know
beauty
you
of
would.
being right around here local.
That's right.
So we're always, whether it's one of our team members going the extra mile after work, bringing a
Right,
prescription to a
right.
patient's home, those are the kind of things that
That's right.
you don't always hear about, but we're doing it, and patients really appreciate it if they give us a chance.
I'm sure. And because Scotland Neck is so small, you probably know everybody, and you
Yes.
can say, "I'll bring it to you, Mr. Smith. It's
Yeah.
okay."
Yeah. So excuse me, all friends and family. So if you're coming to us, we're going to treat you like family, but we really do know, everybody,
Yeah.
and
Yeah.
growing up knew them all. So what a blessing to be able to come back and have a rewarding career where you get to help
Well, and
friends
it's a
and family.
blessing for us in this area that you chose to come back home
Well-
versus, stay in Chapel Hill or Durham or High Point or wherever
Yeah.
you could have gone. I'm sure you had plenty of opportunities.
Well, yeah, I love Chapel Hill for sure. A huge Tar Heel fan. I still go up there to the games whenever I can. And but yeah, I mean, from a young age, I knew that this was something that was a great option, and I decided that there's nothing more rewarding than helping friends and family on a daily basis and being that trusted resource. I would see my father and my grandfather when he was still living, the impact that they had on the
Sure.
community and how
Sure.
trusted they were for all things health and wellness, and it just really meant a lot to me. And
Right.
I said, I think I would like to do that
Yeah,
because
yeah.
it's you're able to help people. There's
Right.
nothing
That's right.
nothing better
That's
than
right.
that.
Yeah.
So I know you know that.
Yeah, I do. All right, it's time for our first break. So when we come back, we're going to be talking about Medicare. I know you hear tons of it. You're probably sick of commercials like I am.
And the calls.
And the calls. But we're going to talk about Medicare, and Thomas can go into a little bit about what would be the best for you. I mean, you can't certainly individualize because everybody's got their own, stuff, but kind of generic things about Medicare that might help some of you all too. So we'll be right back after these sponsors. Don't go away. Hang on.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, welcome back. We're with pharmacist Thomas McDowell, and we've been talking about, really about his store and how he got started. And he's a 4th-generation pharmacist, which I think is just awesome. And I think it's great that he left Chapel Hill, where he went to school, to come back home and take care of his community. I think that's awesome. So we're going to talk now a little bit about, I want to hit up on injections too, but I just talk about Medicare and why is it so hard for people? And there's so many choices and people don't know where to go or what to do.
Yeah, it's a really complicated area that can be overwhelming.
Yes.
I mean, for the patient, and like you said, so many options, so many phone calls, so many letters. When you're about to turn 65, it just feels like the onslaught begins. Mm-hmm. And so we try to help patients navigate that journey. At Medical Park Pharmacy and McDowell's Pharmacy, mm-hmm. we do free Medicare plan reviews where we review a patient's options and just help, clarify what the different plans are and what's best for each mm-hmm. patient. So, there's all the way from when a patient signs up for Medicare for the first time, or if it's just a simple annual open enrollment renewal or picking a new plan. So right now we're in the thick of annual open enrollment.
Oh, yes.
October 15th through December 7th. So that's the one time a year that if you're a current Medicare beneficiary that you can switch your plan if you wish. There are certain circumstances where you can switch in the middle of the year, but most people can only switch during this time period. So we highly encourage our patients to seek out help. From us, we're happy to help, but we want them to, take it in their own hands as well and seek that help to look at their plan, because the plans change each and every year. So the premiums change, the deductibles change, the copays change, the formulary changes. So all these, and we're talking about all these words that might mean nothing to some folks, and so we try to really help clear that up.
Right.
And so we are doing hundreds of Medicare reviews right now, where we have software to plug in their drugs and easily tell what their total annual out-of-pocket expenses will be for 2023. So if somebody switched a plan, it would start January 1st. And so really great service. Nothing against brokers, but sometimes they're only selling a few plans, and there might be, a lot of other plans. And so we try to give the full picture so that, patients can have that full
I think
choice.
People need to have a choice. But if they're like me, I only want like 3 or 4 choices. I don't want 24 choices.
So we try to find that plan that it's like this one looks the best for you, because if you just show them everything, it's like, oh my goodness, that's overwhelming. So we try to tell them, hey, this one's going to best cover your drugs.
Right.
It's going to cover your prescriptions, and it's going to best meet your needs. And there's a lot that goes into Medicare supplements. So there's a couple different routes you can go. There's original Medicare, that red, white, and blue card that most folks know about. That's your A and B, hospital and medical. And then there's the Part D for drugs. And that's a separate carve out that you've got to sign up for separately.
And pay for.
They do have a premium. So you're having to pay your Medicare original premium plus your Part D premium. And Part D is just drugs. There's a lot of different plans, so we navigate that. There's also supplements, and that's
I didn't realize they did supplements too.
So that's just on the medical side. And so supplements help pick up that 20% that Medicare does not cover. So if you just go original Medicare and Part D and you leave off that supplement, you are exposing yourself to a 20% copay, no matter how high that bill goes.
And 20% maybe doesn't sound like a lot, but if you got a $50,000 bill for some kind of surgery,
It's a
and
big
or
copay.
you've had a big heart attack and you've got these expensive cardiac drugs, 20% is a lot of money.
Yeah.
And so when you're on a fixed income, it can get to be really tough.
Absolutely.
I'll probably be working till I'm 90.
it seems like that's the way things are going. And so, there are options on the fixed income. Patients can apply for extra help. So there's ways to get help on your premium depending on your situation. So that's something that not many people are aware of. So there's help out there. So based off your income and some other factors, you can apply through Medicare Social Security office to get extra help paying for your premium. And so we help patients do that, show them how to do that. And there's also Medicare Advantage. That's kind of a buzzword that a lot of people are seeing. That's these companies that are usually calling a lot. And that's where you bundle everything, medical and prescription drugs, on one card. You're waiving your red, white, and blue. No Part D. You've got your one card. And there's pros and cons. And it fits for some patients. Fixed income that doesn't qualify for extra help, it can make sense because a lot of times they are cheaper. But you sometimes will have copays at the doctor. You can't get a supplement. So those are the two routes. And so I know we're talking about all kinds of different options. So
It's really
Go see your local pharmacist.
Yes.
Because we deal with
Yes.
insurance every day.
That's right.
So we're
Yeah,
we're
they know.
accessible,
They know.
and we know the Medicare side of things really well.
Mm-hmm.
And so, you're welcome to call us at Medical Park Pharmacy, 252-443-7979.
Yeah.
And so we can do a free Medicare plan review, but a lot of local independent pharmacies can provide that review
Right,
as well. So
right.
ask
I'm
your
sure they
pharmacist,
can, yeah.
because they can be a great resource for a complicated area.
Yeah, and they can also, if you know, maybe you've had a big heart problem this year and you're on expensive drugs, if you go in and talk to Thomas or to Brandon at Medical Park, then they can say, well, because you're on XYZ medicines, maybe this plan would be the best for you, because some of those get to be super pricey.
Yeah, and there's different coverage based off just the drugs. If
Right.
you get put on some new drugs, the plan that you're in now that was best last year might not be the best next year.
Yeah.
And so it never hurts to look.
Right.
There's plenty of times where we tell the patient, hey, the plan you're in is still the best, but at least you have that peace of mind that you looked at it and
Yes.
that, hey, I'm in the best plan, because otherwise you're just kind of wondering, am I in an okay plan? Am I covered? I guess so. And so it's always good to look.
Yeah,
It doesn't take
yeah.
much time, and it's a free service that we offer.
Yeah, so take advantage of it. And even if you miss the window of time, it never hurts to, Thomas will talk to you next January, February, or June, or July, and you could be, working towards that and planning it for the next year too. So don't, you can always work on it. You
Yeah.
can't always implement it when you want to, but you can always work on it. And it's really, it's really overwhelming. And anybody that's been on Medicare for a while, you understand that, and anybody that's moving into it, you know what he's talking about, phone calls and letters and that kind of thing. And it really is tough. And I'll tell you, insurance they rule the world. We don't make decisions on everything we can do. We are told.
Yeah.
At least I'm told.
Yeah, I don't know what the copay is. I don't necessarily know what it is until we run the claim, and
Right.
and so I wish I had more control over the cost.
Right, but you don't.
Yeah, insurance decides, and the pharmacy benefit managers that are handling the benefits have gotten really powerful. If you look up the Fortune 10 list, there's a couple on there just for processing claims. I don't know how they got so rich, but they control everything on the pharmacy benefit side. But it does bring me back to something we touched on earlier. So if you are in the middle of the year and you're not able to switch your plans, there are a lot of ways where we can help patients lower your cost just with your current plan. Like you said, therapeutic alternatives, always trying to go for a generic if it's available.
Right,
There's
right.
sometimes where the cash price is cheaper than the insurance price. So talking to your pharmacist and having that
Right,
relationship
right.
and figuring out ways, or do I really need to be on this medication? Let's revisit that with the provider. Talk to the prescriber and say, hey, is this the patient's doing better, or can we check a lab and look at this?
Right.
There's options there.
I think I'm going to call a patient of mine and tell her to go over there. Because,
Please do.
well, she has a terrible time with medicine. She's a diabetic, and diabetic medical. There's a couple generics that are effective. Well, one that's really effective. A couple other ones that are maybe a little bit effective.
A little iffy.
But, and then you're talking big dollars. So her insurance, I told her, I said, Elizabeth, you have got to see if you can't get better insurance. And so she went and talked to her insurance and the insurance lady said, well, you've never had to pay a dime for your office visits or your hospitalization. But see, she can't get her medicines.
Yeah, and that's
And so that can
putting
be
you back in the hospital.
right. And so she had a stroke because she couldn't get her medicines. And this lady's, this is still a good plan, and I don't think it's a good plan.
Well, it doesn't hurt to look, and
That's
so
right.
it sounds like there's good coverage on the medical side, but
And you
your
need
health.
that, but you've got to have good comparable medicine help as well.
Absolutely. Or it's a revolving door,
Right.
because even if it's zero, I'm sure the patient doesn't want to keep going into the hospital.
Right.
And that's, nobody wants that. And so
No.
it's a full holistic view of prescriptions
Yes. Yes.
on the medical
Yes.
side too.
And I think pharmacists, I'm a nurse, and so nurses are taught we're holistic. We treat the whole patient. I think pharmacists tend to be that way. Doctors, they hone in on, oh, you got chest pain. They don't look at anything else. Oh, you got a headache. They don't think about the neck. They just throw some kind of a triptan at you or something. But I think pharmacists are a lot that way as well, that you really look at everything, not just, you're not looking just at your bottom line. You're not looking at, I got an overstack of metformin, I got to get rid of it. That's not what you do. You're really there to help them with the best choice for their health.
Well, we're the front lines of healthcare. Often, we're the patient seeing us sometimes 36 times a year. They might see their provider 2, 3, 4 times a year. And so we have that touch point. They're coming to us when they're letting us know about, can you look at this skin rash?
Right. And they do that, don't they?
They do that a lot. They do that in the grocery store sometimes when I'm in the grocery store. But
Oh, we have a call. Hey, this is Linda and Thomas. How are you? Did I do it wrong? Oh. Hey, this is Linda and Thomas. How are you? Lee, how do I... Hey, this is Linda and Thomas. How are you?
Hi there.
Hi.
I just tuned in, so I wasn't sure if this was recorded show or whatever. So I thought I'd give it a try.
Oh, I'm glad.
Just wanted to let people know that are watching that everything you say is absolutely right, because it's difficult to get in touch with your doctor, as everybody knows, when you have questions. And I didn't realize until I started became a client of Rocky Mount Medical Park Pharmacy.
Good.
And they have been a great resource. I can see Thomas smiling, and he knows probably who.
Hey, Miss Jeanette.
Because I feel like I
you know
aggravate him sometimes because they're so friendly and helpful that if you have questions, he's just a great source. He knows a lot, and I have a lot of allergies. Any kind of antibiotic, I never know what kind of reaction I'm going to have for something new medicine that they prescribe. So, but I know he's there, and he's just been a great help to me.
I appreciate that, Miss Jeanette. Glad to help.
Yeah, that's awesome, Jeanette. Well, then beyond a shadow of a doubt that what we're talking about is true, and you know that he's a great guy.
Oh, absolutely.
Yes.
And his staff is as well. They're super friendly, and they never try to put you off or act like you're interrupting their day, and they'll answer any questions you have. And they're just super. I really like them. I would not go anywhere else.
Oh, well, that's so great. Thanks so much for calling.
And no, he did not pay me to call.
I promise
this. I just happened to catch your show tonight.
I
That's great.
appreciate
Thank
that,
you.
Miss Jeanette. That means a lot. We
You
appreciate you.
Have a good evening, Miss Jeanette. Thanks for
Okay,
calling.
thanks.
Bye.
Bye.
All right, now I don't know which one of these I'm supposed to push. I'm not very good at phone things. I only know how to pick it up.
That's what matters.
Let's see. All right, well, we're going to take our next break, and then we're going to talk about all the different, because I've got a whole list of therapies and services that you do at your drugstore. And this is from McDowell's in Scotland.
There's a lot of overlap there.
I was
yeah.
going to say, you
trying to
probably
bring
do
all
this-
those to Rocky Mount too.
So, all right, we're going to take our next break, and then when we come back, we're going to talk more about McDowell's Pharmacy, what he's got to offer you, and why you should be like Miss Jeanette and go there instead of someplace else. Don't go away. We'll be right back.
Come celebrate our 20th anniversary with us and see how we can help with your hearing challenges and hearing care. To celebrate this monumental occasion, when you buy a pair of Livio 1600 series hearing aids or higher, you get one hearing aid for free because it helps to have a spare of equal or lesser value. We know how inconvenient it is to have your hearing aids serviced, maintained, and repaired without a spare. As a community provider, we are focused on individualized care as personalized as your fingerprint. We build relationships with our patients and believe that is the only way to provide the quality of service that has kept us in business for more than 20 years. We have grown and stood the test of time while embracing technological advances and innovations in our industry. We couldn't do it without all of you.
You don't know what anybody can do for you until you have a problem. And when you have a problem, is how the person works through that problem that makes them effective, makes them beneficial in your life. I get involved in a lot of activities at our church. And with the music and things that are going on, I'm going to my noisy setting quite a few times, and then depending upon who's speaking, I may be going to what they call a theater setting, which is a higher level, and so you have to negotiate. You only have, in my case, I only have like 3 different levels. Now, she does have some technology. We have some different volume controls. I don't use that, and I have to work with her, and rather than having to come back to the office, it's easier for me to call her wherever she's at, and we'll set us up a time, and then she will readjust my hearing aids over the telephone, which works real good. And I've used that quite frequently. But usually once you get set up, you don't typically have to change much. And a lot of times people don't want to go through the pain of the setup process, but if you don't spend the time in the setup process, you're not going to have the long-term results.
We are thankful to our faithful customers and look forward to many more years of service to our community.
I would say patients, they say it for us. You know, they refer people to us all the time, and they're not going to refer if they're not happy with you. If they don't think you're going to take care of their friend or their family member, you're going to shut right up. They're not going to say anything. And I've built my business on 75% referrals.
We offer convenient financing, layaway, and many pay options to ensure that our customers have comfortable experience getting quality equipment, reliable service you can depend on, and the product that fits both your physical and financial needs. Please visit our website, downeasthearingcare.com. Don't miss out. Schedule your appointment today.
Through the month of October, we want to invite you to our VIP by appointment only open house. Here at Down East Hearing, for the duration of the event, we're offering a look at our waterproof hearing aids and our new 3D printed custom ear molds. Things we know can improve your hearing related situation. So call for your appointment and find out what specific needs Down East Hearing can assist you with today. Call 252-378-2018 and set up your appointment, or check out Down East Hearing Care on Facebook to find out more about the things we're doing through the month of October.
All right, we're back. Hello. This is Linda, and I'm here with Thomas, and we are talking about McDowell's Pharmacy and MedPark Pharmacy here in Rocky Mount. McDowell's Pharmacy is in Scotland Neck. Talking about his old building. I'm going to take a ride over there and check it out. I'm off on Fridays, so I might just pop in, and he might have to take me across the street and buy me a piece of cake.
I'll be happy to. It's
I don't
worth a
think I need the
visit.
cake.
Yeah. You've got to try it at least one time.
There you go. That's right. So you've got several services that are listed on your website and for McDowell's, and you said, and I'm sure we've got a lot of them here in town too. So, what is MedSync? What is that?
Yeah. So MedSync is a service that we offer where we line a patient's medications up to all run out at the same time, sync them up. And so what that does is saves them trips to the store, makes things less confusing, and we keep up with their medications. We make sure we get their refills in, we coordinate a pickup date, get all their medications in stock. So instead of them coming in every other day, it seems like, to get a prescription, they can go one time a month and get all their prescriptions all at one time.
Nice.
So,
That's great.
and that's free.
Awesome.
Free service.
Oh, really?
And
That's even better. I like free.
We recommend everybody do it. If you're taking one maintenance drug, it's worth doing it because it takes that burden off of you, off the patient.
Yeah. And then you have durable medical equipment at both stores or just the one?
We've got a probably a bigger selection at McDowell's and Scotland Neck just because we have more space, but we do medical equipment billing at Medical Park too, more smaller items, but we do offer diabetic testing supplies and some braces and can do walkers and canes and rollators and that sort of thing. So, and if it's something bigger or rental item, we'll refer that out.
Sure, of course. Medication therapy management.
So, yeah, that's a broad term, but that involves some of the things we do outside of dispensing. So we do medication reviews, comprehensive medication reviews, where we sit down with the patient, go through all of their medications. We're looking at side effects. We're looking for duplications, interactions.
Right.
Sometimes we find out that they're taking supplements that we're not aware of. So really informative meeting with the patient and the pharmacist. And it's anything we're doing clinical can fall in that MTM bucket. So when we're talking about adherence or coordinating with the provider on a therapy issue. So going that extra mile beyond just pills in a bottle.
It's awesome. And then you've got med packaging enhanced services.
So that's what we call our MACPAC program. So that's adherence packaging, where we sort a patient's medications by date and time. So multi-dose, we're getting rid of the pill bottles. We're putting the medications in either pouches or blister cards that they're sorted by the date and time. So all you do is when it's time to take your meds, you punch it out or tear the pouch and take your medications right then and there, and you don't have to fill a pill box up. You don't have to worry about, I just ran out of meds. We're handling all of that. So it's kind of MedSync plus more. And so we've got 400 or 500 patients on that program.
Oh, wow, that's great.
And then we also deliver free to the home. And so relieves that burden of, Sundays are, usually spent filling a pill box when you get older, or either the caregiver's doing it. So that's out the window. You can free up your Sunday again to do something fun.
That's right.
And so that's a great service, one of our most popular services.
And then you, as a pharmacist, and you're trained to give injections. You're trained to give immunizations. So is that part of your pharmacist training? Is that in additional to when you go, if pharmacy school is like nursing school, you get the very basics, and then you get in the real world and you wonder what the heck
more.
Yeah.
Great question. So it used to be something that was kind of extra, but they've actually built the immunization certification program into our curriculum at pharmacy school. So you really don't have a choice. You're going to get certified to vaccinate. And so I did that early on and brought vaccines to McDowell's for the first time. Randy Crawford was doing some vaccines. We've expanded the vaccines at MedPark Pharmacy. And so we, at every store, each store, we have, try to always have somebody, if we can, that's there that's certified. And now technicians can actually get certified for flu and COVID through the Emergency Prep Act during COVID. And I think that goes through maybe 2024 and might be extended beyond that. And so they can get trained under a pharmacist. And
do you all give COVID injections, immunizations at the pharmacies? Okay, because we aren't doing it at our office. I don't know if other medical offices are or not.
Yeah, a lot of the primary care clinics and medical offices didn't go into the COVID. There was a lot of logistical issues and a lot of storage issues. So pharmacies have really been on the front lines in that area. So we get a lot of referrals from providers in our building. They'll let folks know we have the COVID vaccine. And so we've done thousands of those since the pandemic started, or since the vaccines became available on the market. And so it's great to be a resource where a patient wants that vaccine, they can come to us. And we also do flu, of course. We're getting into the thick of flu season. We do pneumonia. We do shingles.
Let me tell you about shingles, people.
Not fun.
No, shingles isn't fun. But Medicare, in their infinite wisdom, if I want, you come to me and you're my patient and you're 65 or older and you need a shingles shot, I cannot give it to you from my stash or my supply at the office. I've got to send the prescription over to Thomas, and he'll get the vial and he can give it to you, and you can come back to the office and I can give you the shot. Or I can just send the prescription and Thomas can give you the shot.
Yeah.
I don't know what it is. It doesn't matter what it is because it is what it is. But
That's a strange one because they, on the insurance side, getting back to the joys of insurance, it's not paid for on the medical side. And so that one's going through Part D like a diabetes drug.
Okay.
And so it has a copay right now. And so sometimes it's unaffordable for some patients versus flu and pneumonia and COVID are free. That is changing though. 2023,
good.
There's legislation that requires all covered vaccines. I think it's just under Medicare. Any vaccine that's covered on formulary has to be zero.
Oh,
so
really?
Shingles will be zero.
Oh,
Shingrix
that's great.
will be zero at our pharmacy.
Because I try to remember to give them before they hit 65.
Because they're free on commercial insurance.
Yes. And then, I forget, and then I feel so bad.
Then if they have a deductible, it might be $200.
Yeah.
And so, definitely, that's a great thing that's happened. So I'm looking forward to not having to tell that patient that they've got a huge copay.
That. I'm glad that will relieve me from my guilt when I forget to give it to them. And then, do you all have to, like when we give immunizations, we have to record it with the state? Is it the state registry?
Yep.
Do you all have to do that too?
So we do, and we COVID we're able to have an automated system for that, and we've made it more automated. But yes, we do. Try to make sure we're putting all of our vaccines on the registry so that other prescribers can see.
Right, which is good, so that you've given the Shingrix and I'm saying, have you had it? And they say, I don't know, Thomas gave me something.
I was about to say that I'm sure you see that just as much as we do. They come in and we're like, have you, Miss Smith, have you had your pneumonia shot? Maybe. I think so. And
I think Linda gave it to me.
And so instead of calling you and bugging you, we can go to that registry and say, yep, you've already gotten it, you're good.
That's right. So, all right. So now you've got Wellness for Children, Enhanced Wellness Services.
So that's, and we blanket all of our services as enhanced services. That's kind of what we call them just because they're above and beyond what you might traditionally see at a pharmacy. And so for our kids services, we have a free vitamins for kids program. And so really helpful, especially for folks on a fixed income or the picky eaters that are not eating their vegetables and fruits. And we're working on that with my son right now. We're getting there, but it's a challenge. And so we offer that program for free just to allow them to have something that they can take. And those are chewable vitamins for kids. And we also do that for adults too. But I try to, if budget allows, to go with one of our really high quality vitamins, but sometimes there's certain situations where if their diet is not there, that's an option. So.
And you've got a mobile app?
Yeah.
Ooh.
We just rolled out a new mobile app. So it allows secure messaging straight to the pharmacy. So you can message us, because HIPAA is always an issue with any messaging. And so you can download our app. If you just you can come to the pharmacy and ask us about it, call us about it. It's called RX Local. If you search RX Local and then put in your information, it will actually connect you to our pharmacy automatically, because it can tell that you're one of our patients when you sign up and put your information in there. And you can text us if there's an issue or if you need something, and it's completely secure. You can set medication reminders, and it's a great resource. So we're trying to push that now to help patients, because patients are busy. People are busy. It's hard to call the pharmacy when you're at work or have kids.
And I appreciate the automated system versus having to wait for a person, and I'm sure you've got an automated system
Yep.
on your phone.
That's one of the first things we did was bring in a voice over IP so that you can type in your refills
Right.
Without actually having
Right.
to wait for somebody.
That's right. I know, it's nice. All right, well, let's kind of recap here because our time is almost over. It went fast, didn't it?
Hey, it flew by.
I
It
know.
flew by.
We're gonna
You
have
told
to
me
have
it
you
would.
back. I did. I told you it doesn't take long. This hour does not take long. So tell us one more time where you're located, your 2 locations, your hours, how they can get a hold of you.
Sure. So I'll start quickly at McDowell's Pharmacies in Scotland Neck, so right down the road from Rocky Mount, 1004 Main Street. 252-826-4137 is the number. www.mcdowellspharmacy.com. 9 to 5:30 Monday through Friday. I would love to see you there. If you take a day trip, see Sylvan Heights, stop by and see us. For Rocky Mount, and probably more viewers in this area, Medical Park Pharmacy is at 901 North Winstead Avenue, Suite 100. In the Rocky Mount Medical Park building, or commonly referred to as the Boyce Willis Clinic. Almost everybody's been in there.
I do that.
I tell somebody where we're at, oh, I've been there.
Yeah.
Everybody's been there, so it's really convenient. We're in the 5-story brick building near the Cracker Barrel, El Tap, across from the old Shiny Diner that closed.
He's my neighbor.
So we're
At
right
work.
there next to Family Medical,
Yep.
and next to the new Boyce Willis Clinic as well. And our number is 252-443-RXRX. Something Randy did, and
that's cute.
And that's
I was gonna look
252-443-7979.
Yeah, that's what I was going to look at. Yep, 7979. Oh, that's cute.
Yeah, so that was
That's
back
pretty
then. That
smart.
was really
Yeah.
a great marketing tool, and so our website's RockyMountMedParkRx.com, and we look forward to serving you. And if we can help in any way, give us a chance. I think if you try something local, usually once you try it, you
right.
realize that it's a great experience and a great relationship.
A good service. Yep, that's right. All right, it's time for us to say goodbye. Thank you so much for watching. Thank you, was it Elizabeth? What was that lady's name?
Jeanette.
Jeanette.
Yeah,
Thank
Miss
you, Miss
Jeanette.
Jeanette,
Yeah,
for calling.
that was great.
I've got Elizabeth written down here. I'm going to call one of my patients tomorrow and tell her she's got some problems with her medicines, and I'm going to have her call next door to MedPark and see if they can't help her out some. Anyway, thank you so much. It's so good to have you with us. You have to come back.
I would love to. Thank you
Okay,
for having me.
awesome.
It was awesome experience.
All right,
Thank you, Linda.
That's right. All right, we'll see you next week with more Here's Your Good Health. Good night.